Thousands of families across Michigan are starting 2026 without health care. Some lost coverage after job changes, others simply can't afford higher premiums. And experts say the number of uninsured families is climbing, driven in part by higher costs with the expiration of Affordable Care Act subsidies. This year, roughly 491,000 Michiganders signed up for marketplace plans, down from just over 531,000 in 2025. That's a difference of about 40,000. This morning, I want to show you that losing insurance doesn't have to mean losing out on high quality care. The start of the year came with a lot of tough choices for so many Michigan families. Pay higher health care premiums or pay the bills. That choice has caused a lot of families to go without coverage. For Byron Kelley, that reality hit many years ago when he lost health insurance. But instead of skipping care, he found another option.
I mean, everything that you actually need is right here at MyCare.
MyCare Health Center is a federally qualified health center with locations in Centerline, Mount Clemens, and Clinton Township. Kelley says he's been a patient since 2012.
The doctors, they show love. They show interest in my health. So why go somewhere else?
MyCare Health Center CEO Karen Wood says when times are tough, more Metro Detroiters turn to healthcare centers like hers, where growth is up 127% since 2010.
What do you attribute that growth to?
I think high quality care and the need. Yeah, the need is out there, and we don't turn people away based on ability to pay.
MyCare is one of dozens of federally qualified health centers across the state charged with filling the gaps in healthcare services. These centers can provide medical, dental, behavioral health care, even case management, all under one roof. Most accept commercial insurance, marketplace plans, Medicare, Medicaid, and a discounted sliding scale is offered to some patients who pay out of pocket.
The work that we do, I honestly believe, is healthcare's best kept secret.
And it's not just the cost that makes these health centers a great option. University of Michigan physician Dr. Mark Fendrick says it's also the quality.
These FQHCs are very well qualified to provide much primary care, from preventive services to management of common chronic diseases.
For everyone, from babies to seniors. According to the Michigan Primary Care Association, these centers already provide care to 1 in 11 U.S. residents, 1 in 8 children, and 1 in 4 people without health insurance. In Michigan, they serve more than 715,000 patients every year. But medical visits are only a part of the challenge.
It's not unusual for people to go without prescriptions or maybe take it every other day just because they simply can't afford to pay for it.
MyCare uses a federal discount program to lower medication costs. Dr. Fendrick says families can also look for $4 generics from some big box retailers and major grocers, and assistance programs from drug manufacturers. Then there are online options.
GoodRx and Mark Cuban's Cost Plus drugs are well known, but there are several.
Financially, healthcare in America is a patchwork, and navigating this healthcare maze a source of frustration. That's why Byron says he's glad he found MyCare.
I love the place. That's why I kept coming after all these years.
And why Karen Wood says centers like hers will keep trying to fill the gap.
What's next for MyCare Health Center?
We keep growing. We keep growing to meet the need.
Now, I know this is an issue that is important to so many Metro Detroiters. That's why we attached a link to this story on our website to help you find the federally qualified health center closest to you. We also have a link to Michigan's MyRx prescription drug discount program and the more than 2,400 participating pharmacies and other pharmacy resources to help you bridge that gap.